Week 5, finding information and outcome measures. There are a couple different ways that we as clinicians will gather information. Often the most commonly thought of one is about doing patient interviews. That is those things, those questions that you ask when the person first comes in to see you for your services. So that would be that initial intake. And then of course there are any follow-up sessions that would be an update to their health history, activities of daily living, kind of all those basic questions that you ask. We consider that patient interview to be what we call a soft search. So some of the harder searches, if you will, not that it's difficult, but the hard search is more about that background search and then the foreground search, which those are the things that we're going to be delving into in this PowerPoint. So background searches are things like internet or textbook based, and then foreground searches are internet or research article based. Again, with those patient interviews, we start out with those basic questions. What brings you in today? What are your goals? Tell me about your symptoms, those kinds of things. This is all the information that you're learning in the preclinic workshop, the things that you are practicing when you are down in the Darusha, HPC, when you're out at the various sites. You're asking those you're asking those questions to gather information from your clients and your patients about what it is that they're needing, how you can use your services to best help them. All right, so hard search, we look at this as, again, it's that background and it's that foreground. So if we look over at the background search, those are things like mayoclinic.org, medlineplus.org. Those are the places where you go as a regular person, quote unquote regular person, to gather information about something like, let's say, low back pain. And so that's going to give you some basic information. It's going to be maybe some treatment outcomes, maybe some common suggestions, and then maybe some resources on where to go if things, are getting really bad. If you've got X, Y, and Z symptoms, then perhaps you should go and see your primary care physician. Otherwise, maybe doing some stretching, getting a massage, having some acupuncture, those types of things. The foreground searches, those are those things that you look up for specific conditions, right? PubMed, PubMed Central, Google Scholar are really common places for people to go to find specific research articles. Now, Cochrane Database, Natural or Alternative Medicine Database, and the National Guideline Clearinghouse, those are databases. So what that's going to do is that's not going to give you specific information. It's going to give you a whole bunch of information that you can then narrow down. So Cochrane Database, for example, may house multiple journals, and then you can go ahead and look at those different journals for specific articles. And we'll say more about that here in a minute. So let's just, kind of take a big broad, let's step back a little bit. Let's take a big broad look at how in the world do we even start out determining if we need to do what kind of search we need to do. So in scenario number 1 here, so we've got this fictitious Janet, who is a 48-year-old woman. She has been referred to you to be treated for low back pain. During your evaluation, you notice she has significant weakness in her left lower extremity to the point that it affects her gait. So during your initial intake, you ask her about it, and she states, "Oh, it's no big deal. I was diagnosed with Charcot-Marie tooth disease years ago." And you internally you go, what the heck is that? So how do you proceed? Because have you ever heard of this condition before? How do you know if you can proceed with massage? How do you know that some of the techniques that you do may hurt or may be beneficial or not so beneficial for her? So how do you go ahead and proceed to find out about what this is, and will the things that you are doing, your technique, your training, is that going to be helpful? So we do that through PICO. I talked about that a little bit last week. And so what we're going to do, you're going to, you say, okay, you want to do a little bit of gathering some information about this. So the first thing is that we look at P, which stands for the patient or the problem. So in this case, we're looking at a person who has a specific condition. They've come in, she told you that she has been diagnosed with this condition multiple years ago, and it's no big deal. Then, all right, so we got our 48-year-old female, low back pain, Charcot-Marie tooth disease. So I then stands for the intervention. What's your intervention? It's massage, right? So then C is the comparison. So what are we comparing it to? So we got low back pain, we got massage, and we don't really have anything to compare it to because she's not asking you if which would be better, massage or acupuncture. But basically what we're looking at is we're looking at low back pain and massage. The low back pain is related to this condition that she has. And then O is the outcome. And one thing I want you to be very clear about is that for yourself is that outcome is different than outcome measures. I'm going to talk more about those as we go through this. So what we're trying to decide here is this condition that she has with the low back pain and the massage, and the outcome that we're hoping for is a decrease of low back pain. Scenario number 2. All right, Becky, 42-year-old woman who has been suffering from muscle tension headaches. Since you have helped her so much, she asks you if you can help her sister. She states, my sister has terrible fatigue due to her fibromyalgia. She has been taking medications. Do you think you can help her? What kinds of things do you say? And what do you do about this? So here we can organize our search by looking at what our patient and problem is, right? So we've got a woman, fatigue and fibromyalgia. I is that intervention, and it is massage. C is the comparison. So we're wondering about comparing fibromyalgia, medication, and massage. O is that outcome, which is obviously a decrease of fatigue. Now, some key words and search terms that you're going to be using. So you're going to go on to the school's website, the library website, which you were directed to take a little bit of a look at. And some of the things that you can do is you can start to narrow down, because if you just typed in women and massage, what are you going to get? You're going to get, probably a couple thousand articles, journals, sources for women and massage. But we want to narrow it down a little bit. So we want to look at things like low back pain. We want to look at Charcot-Marie tooth disease. And we want to look at massage. So you can put those things in to your keyword or search terms. They call them Boolean. So you can narrow those down a little bit. In scenario number 2, again, we've got women, fibromyalgia, fatigue, medication, massage. Those are some things that we can take a look at to determine if massage is any good. Is it massage better than medication? Is medication better than massage? Does it help to reduce fatigue? Does it help to reduce issues that are other conditions or other symptoms that are related to fibromyalgia? So we just kind of have to start looking at big, broad, kind of the big, broad picture, and then narrow it down so that we don't have to read through, 22,000 articles. Maybe we find 22 articles that fit the criteria of what it is that we are trying to determine if it's helpful or not. I want to bring you back again, just kind of take a little bit of a step back so that you remember when you are doing these searches for articles, you're starting to look at kind of what's the credibility, the validity, the trustworthiness of some of these different types of studies. And I want you just to remember that the higher up that we go on our little pyramid that we got here, the more valid and the more reliable. So remember, with those narrative reviews, the opinions, the editorials, those are really based on maybe one person's experience with, with being a chiropractor for 20 years. And this is what they say works the best for them about when somebody comes in with symptoms related to fibromyalgia. Then remember that a case study is just a single case. It's just a single person. And maybe what we're doing is we're, doing massage on them for 6 sessions, and then we're writing up a little report about this specific technique that we did that was really awesome, that helped this person deal with their low back pain. A case report then is going to be maybe a couple people that we're looking at, and we're taking a whole bunch of people, and here, here's this what I've done for these 10 people, and it's been awesome. And so then I'm going to write up a little bit of a report about this. Where a case control study is that we're probably got a couple different groups, but we're not really doing true investigative research. We're just kind of writing up, here are people that got treated this way with this condition, and here's another group of people that are similar to them, and maybe we didn't do the same thing, and we're looking at the different outcomes. So that may be something we want to write up. And then with that cross-sectional study, remember, this is kind of a snapshot in time of a certain group of people. So we're going to go interview every 18-year-old that on the day of their high school graduation at one specific school, and we're going to ask them all the same question. And so we've got this little snapshot of what it was like on graduation day for this group of 18-year-olds at this one particular school. Cohort study. There's some similarities with the cross-sectional, but it's a little bit different because with cohort studies, we tend to follow them. So we take a group of people, we've got, we're going to do this cohort study, and what we're going to do is we're going to find all of the nurses that have been registered in the American Nursing Association, and we're going to ask them to participate in this study. And what we're going to do is we're going to take some baseline measurements, and then we're going to follow them over time. So that's just kind of a quick a bit about those different types of study. And then of course we get into the randomized clinical trials, which is where we're looking for cause and effect. And then the systematic reviews and the meta-analysis, that's where we're gathering all of the information about a specific topic, and we are looking at inclusion and exclusion criteria, and then we are distilling them down. So remember that with a systematic review, it can be both qualitative and quantitative data. So we're looking at both language and we're looking at numbers, whereas with meta-analysis, we're just looking at the analysis of the numbers. So search engines to find some quality health information. So we're taking a look. We want to make sure that we kind of keep this idea, this definition of these different types of studies in the back of our mind as we're starting to pull up some information. So we're gonna, do a little background search, and we're gonna, look at this from disease, treatment, medications, kind of general information, like I said towards the beginning. So we're gonna put in there low back pain and fibromyalgia, or just fibromyalgia, and it's going to give us a whole bunch of information about like who maybe it's pretty common for, what are some common treatments, what are some just easy, simple things that can be suggested about what kinds of things people can do about it on their own, what are some typical outcomes, and then maybe what are some signs and symptoms when people have to maybe take it to a higher level and talk to their primary care physician. And then those foreground searches. So this is where we really kind of need to keep that whole idea, the definitions of different types of studies. We kind of need to keep those in our mind, because with the foreground searches, we're looking at more formal research. So this is cited research. It's full text versions. This is the actual original studies. So we can do that through Google Scholar or through PubMed or Cochrane database. But remember, we want to use those as giving us some a way to then search with more specific, detailed information, because Cochrane database, PubMed, they're going to give us journal specific journals that we're asking about, and then it's going to give us, then we can start narrowing things down on, putting in there, like, 42-year-old male with upper back pain, and we can start looking at we can look for, randomized clinical trials that may have been done. These are peer-reviewed research articles. We can look at meta-analysis, we can look at some of that summary research, and we may even find some things that are maybe cohort studies. And so that's where that's really kind of getting down into the information that's going to be gathered in the foreground searches that you don't find in the background search. The background search is just giving you kind of that basic overview of a condition, where, remember, the foreground search is really about original research. It's about summary research. It's about it gets more specific. So some ways that we can do those searches, remember, where we can do things like put in key words or terms. So we can use words like massage, massage therapy, manual muscle manipulation, all of the kind of different ways that massage gets categorized. We can also take and look at specific techniques. So we may want to look specifically for how does cross-fiber friction help with whatever the condition is, low back pain or knee pain. We can look at, different techniques, relaxation, reflexology. We can get into all the different various types, Swedish massage, Tuina, different things like that. Just again, some different techniques that are available in massage. And then of course there are, we can narrow it down by foreign languages. So manual lymphatic drainage is actually something that was developed by a French person. And so you may find that it's listed under a foreign language. Tuina, again, is more related to Eastern medicine. Acupuncture, it's kind of in that realm. And then words like effleurage, because that's a French term that's used, effleurage, petrissage, tapotement, those kinds of words then that we think of as just basic massage strokes, actually are evolved from a foreign language. And then we want to also look at different countries, because the United States does not have a corner on the market on research. We have to remember that there's a whole great big world out there where they are able to do research in ways that we may be restricted here in the United States as a result of restrictions on who gets funding for research. That's a big deal. I know that I talked about that in what kinds of research gets done, funding, outcomes, those kinds of things. So we need to look, at France, China, Russia, Israel, Australia. Lots of different countries do research, and so if you speak that language, then you have a little bit more of an advantage. But a lot of countries outside of the United States actually do publish their research, various parts of their research, or entire articles in English. And so just because it's published in France or the article was, or the research was done in France, it doesn't mean that it's not in English. So just keep your mind really expanded and open when you start thinking about doing searches for conditions. When you do those searches outside of the United States. All right, so outcome measures. This is a little bit different than treatment outcomes, right? So the outcome measures are things that we are concerned with, that are done in a clinical setting to help to determine progress or satisfaction or some other area of interest. So there are a couple of different ways of categorizing this. There are clinician measurements. So the clinician measurements are ways that we monitor health status and assessment measures, right? So range of motion, blood pressure, height and weight, the things that we take, and there are some strong numbers to them, and we can, use a tool to measure that. So you can use an inclinometer for range of motion, you use the sphygmomanometer for blood pressure, and of course you use a scale for height and weight. Those are just a couple examples. Where there are client reports, which are things like pain scales. 0 being nothing, 10 being the worst, on your worst day, on the best day, on average. Those things you're kind of used to or getting used to in the pre-clinic workshop. And then asking people about their symptoms, right? So give me an idea about what your headache feels like. Where do you notice it the worst at? Is it worse in the morning? Is it worse at night? Is it worse if it's really hot outside, or there's all kinds of ways that people are affected by things outside of themselves, and that affects their symptoms. So you want to start getting in the habit of kind of asking people some of that information about their symptoms. So this essentially is what the client says is going on for them. Now, objective and subjective measures. So subjective measures are those self-report questionnaires. So this is based on the experience of the patient in the patient's words. How do you feel about this? How would you rate your pain, your stiffness, your activities of daily living, and how often do you experience whatever it is, headaches, back pain, foot pain, neck pain, whatever it is that they're coming in to see you about. So the thing to remember is that what % of conditions will you treat based on the client's subjective experience, and it's all of them, 100%. So you really want to get good at asking people questions about what's going on with them, and then recording those in an appropriate fashion. So part of the reason for doing that is then in a couple weeks when they come in and they say, oh my gosh, it's not getting any better, you can maybe look back in your notes and go, hey, wait a minute, today you're saying that your headache is a 5 out of 10, where when you were in here 3 weeks ago, you said that your headache was consistently a 7 out of 10, and we've really made some progress here. It may still feel like you're experiencing a great deal of pain, but actually it looks like things have gotten better, and we've recorded that. And that can be really helpful for people because they may not have a clear view of just the progress that they have made. And so by you documenting and kind of, talking to them about what it is that you have noticed, and based on what it is that they're reporting, you can actually see that they have made progress. All right, so outcome measures are measuring and utilizing outcome assessments. So these are things that help us to make clinical decisions because they're systematic, they're focused on the patient, they're helpful when creating a session or long-term plan, and ideally they're efficient and they are effective. I'm going to talk a little bit more about that. So some advantage of it is that they are systematically and objectively monitor client progress for all the reasons that I just said. You have good documentation about why the work that you're doing is awesome and how it's been helpful. These things can be helpful in making clinical decisions. They can help to set realistic goals instead of when a person comes in and they say their headaches are a 7 out of 10, and you ask them what their goal would be for today, and they'd say, oh, it's a 0. Well, that's not really a realistic goal. Maybe a 7 out of 10 and maybe getting it down to a 5 out of 10 would be a realistic goal for the session, and maybe it can be like over a period of time we get it down below, the 5, below the 4, maybe even down to a 3, right? So we can, again, show how the patient is progressing. Again, it's to justify treatment decisions, for referring to collaborative providers, for insurance companies, attorneys, kind of all those things that I talked about in that week 1 on why we're learning how to do some of the stuff that you're learning both in this class and in the pre-clinic workshop, so that you can really have some good clinical justification and some good clinical information about why massage isn't just some kind of a thing that people do when they just want to relax, right? There's actual medical reasoning behind why what you're doing is helpful for people in more than just getting rid of their shoulder tension. So again, kind of then getting back to that the results that you come up with could actually maybe help you write up a case report. We don't have enough research in integrative care and complementary and integrative care. And part of the reason is because people are not writing things up. There isn't a ton of money. It hasn't been given classically, traditionally been given to complementary and integrative care. But if we start writing up case reports about, really awesome interventions that we've been doing and how people have progressed and gotten better, then that actually starts to give more validity around why money should be funded or money should be given so that research can be funded in things like complementary and integrative care. So using some outcome measures, we want to start out first of all by getting that baseline outcome. So that's the question that you ask at the very beginning. Give me an idea today about how you're feeling right now. What's it at its worst, and what is it at its best, and what helps things to get better, or what makes it worse. So having that understanding, and then, there's other things, range of motion kind of things. Those are the things that you do before you actually intervene with your massage. So it's before treatment and at regular intervals, because then what you want to do is you want to create a plan, and you use the same outcome measure, the same tool, right? So if you're measuring, say for instance, if you're measuring a person's range of motion for their low back pain, there is a test that's called sit and reach, and it's flexibility in hamstrings, which can be related to low back pain because tight hamstrings can cause low back pain. So you're not going to switch measuring tool in midstream. So you're not going to go first, the first time they come in, you're going to do sit and reach, and then the next time that they come in, you're going to do a different measurement of their low back pain. You don't want to do that. You want to make sure that you're picking one and you're utilizing that both for baseline measurements and then for afterwards, and then maybe even at a set interval in 3 treatments, in 5 treatments, whatever. But you want to make sure that you are, again, sticking with the same tool, and then you want to make sure that you are actually measuring what it is that that you're intending to measure. So don't collect the data if you're not going to use it. So if you're not gonna, if you don't really care about, somebody comes in with low back pain, you're not maybe necessarily gonna be so concerned about their neck pain, but you are going to be concerned about what's going on with their back. And so you want to make sure that the data that you're collecting, you're actually going to use as it relates to the person's symptoms and the reason why they came in. You want to make sure that they are valid and permission is granted when you are using certain outcome measurements. You want to give credit where credit is due. And so if you have a measurement tool that you're using that someone bothered to spend their time and energy in creating, you want to make sure that you give them credit. I'm going to give you a couple examples in a minute about the permissions, and because oftentimes it's based on the name of the study is based on who created it. Give credit where credit is due, just like I said. All right, so which tools would you use? So when you're choosing an outcome measure, you want to make sure that it is relevant and patient-oriented. You want to make sure that it's reliable. So this kind of goes back to what I just said, that you are actually measuring what it is that you intended to measure. It's reproducible. It's valid, and it's used commonly, so it's not just something that somebody pulled out of the blue. It gets used quite a bit, so there's a great deal of information around it, and which then tends to lead towards its validity and reliability. You also want to make sure that it's really easy to administer and score, both for the clinician and for the client. It doesn't make much sense to have a 50-question survey about a person's low back pain. People aren't gonna do it. So, a couple questions about it. Usually 5 questions is a pretty good measurement. You can get some pretty decent information, and then it's easier for you to take a look at as a clinician, as a provider, to take a look at it, and then it's easier for other people to take a look at it as well, to see that what you were doing, that you were really focused on what it was, the condition, and what it was that was going on with the person. And getting down to the end here, so some patient outcomes that we measure as massage therapists. So those are all those things: pain, activities of daily living, range of motion, satisfaction with treatment. Those are those things that really make a difference. Again, that's kind of that baseline stuff. So give me an idea, baseline, what's going on with your pain. Give me an idea of what's going on baseline with your activities of daily living, range of motion stuff, and your satisfaction. And then that's something then you can ask at the end of the session, or you can ask them in a couple of weeks, again, based on whatever it is that you've decided for the long-term treatment plan, but just kind of, again, sticking with those same tools. If you're using a pain scale, 0 to 10 pain scale, at the very beginning, don't then ask them a different way to manage or report their pain at the end. You want to stick to that same initial pain scale. That's just an example. All right, some other things to consider. Scoring is specific to the tool or the assessment that's used, so you want to make sure that those two match. Scoring is for assessment purposes only. You're not diagnosing. You want to report only the name of the tool and the score or findings in your notes. You're not making any clinical judgments about that. It's out of your scope as a massage therapist. You want to stay away from interpreting those results, and you want to make sure that the language that you're using is clear and concise and makes sense to whoever might be reading it after you. And these are just some examples of some outcome measures. There's things that are called, it's called the Rowland-Morris questionnaire, the Oswestry questionnaire. Those are for low back pain. There's things like the Neck Disability Index. These are pretty common ones, the Fibromyalgia Impact Questionnaire. And then there are other things when you start getting into things like quality of life and mental health. You can see on there that there are some different names for some of the different tools. Again, these are valid, they're reproducible, they've been used by many people. And then if you look really closely here down in the bottom, you can see copyright 1999, Pfizer Incorporated, all rights reserved, reproduced with permission. So that's just kind of a way to make sure that you're giving credit where credit is due. All right. So weekly graded activity, please make sure that when you submit your weekly graded activity, you save and send either as a Word document or submit as a PDF. You want to make sure that it's your last name, followed by your first initial, followed by FEIP, followed by WGA 5. So then I know exactly which one it is. I can grade it and then submit it back to you. All right, if you have any questions, let me know.